Just a couple of weeks ago, I put another 800 million into.
How can we make sure that patient data privacy isn't compromised?
It's quite shocking for me just discovering this.
Hi, my name is Dev, also known as DoctorDevify, and here I've got Mr. Peter Kyle, who's the Secretary of State for Science, Innovation and Technology. Thank you so much for being here.
Thanks.
Really appreciate this.
Not at all, it's a pleasure.
I've got quite a few questions for you.
Have you?
So yeah,
Let's have them.
not too many. What role do you think AI and machine learning will play in the NHS?
It's going to play a profound role. The thing about AI is that it's a general purpose technology, and we're only in the foothills at the moment, so we're not quite sure the exact applications and where it's going to take us, but it's just really exciting.
Yeah.
So if you just take two diverse applications we know it's going to have an impact on. First of all is productivity of clinicians in the front line. A lot of the work you will be doing with paperwork, discharges, admittance, and then prescriptions. AI can have quite a considerable impact in speeding the way you get through the admin. That would mean as a clinician, you'll have more time doing the frontline doctoring and less time doing the admin. That is a ratio that is in the bed to the benefit of you. It certainly would improve the quality of and the enjoyment you take from work, because I imagine you enjoy doing the clinician's work, not the admin side.
Less of the admin, yeah.
Exactly. It's certainly better for the patient and certainly better for our health service, because you'll be spending more time with patients and less work doing the stuff that isn't patient focused.
Absolutely.
And another application that's already being used is in the radiography department in Huddersfield, where we see full integration of AI. It means that scans are more effective, because AI is incredibly effective at finding early stage patterns where human eye struggles to find patterns. So when people are presenting with chest pain and you do a chest scan and maybe the pain is in the abdominal area, it also looks for areas around the lungs where there might not be expressing pain, and it finds very, very hard to detect patterns that might be worth looking at. So very, very good at spotting early stage lung cancer, which of course is a priority. Radiographers have been retrained and their pay has gone up as a result, but because of the increased productivity, it's cost neutral to the department.
That makes sense.
And yet people are more highly skilled, getting more pleasure from the job, highly paid, and the scans are more effective. So these are two areas where it's a real win for the NHS in productivity terms, quality of service to the patient, and that's just two diverse uses for the same technology. And now think how that could be applied right across the broad spectrum of primary care, social care, and all the very specific parts of the NHS, and you get a sense of just how important and impactful AI is going to be.
Yeah, so it's only just the beginning, I guess. I am looking forward to it, but a lot of my viewers are quite concerned. So there's a lot of technology companies that are handling patient data. How can we make sure that patient data privacy isn't compromised?
So privacy and safety is going to be baked into the start of everything we do. So we have the AI Safety Institute in my department. We also have a lot of protocols that we're developing so that safety will be there at the beginning, and the privacy of people's data. Now, we know that people don't always trust government for these sorts of things, and they're distrustful of the use of data overall. We've got a lot of work to do to build trust, because all the things we just spoke about cannot happen unless we can take patients with us. And unless we have the permission of the public, we're not going to be able to fully explore all the potential that AI and other technologies are going to have. So we're putting a lot of work into explaining to the public exactly what AI is, how the use of data into the future is going to be used with their permission, and we have to take people on that journey. We're also starting work, and I've already begun this work, of creating the National Data Library, where all government data is going to be brought together and made accessible together, because at the moment data is stored in different systems, in different ways, in different places. We want to bring it together so that data can be used for the service of patients and public service users and citizens alike. And again, this is a hugely ambitious project. Privacy will be absolutely baked into it from the start, so that people's individual data will remain their own. But collectively, when we start to use data more smartly, it means that we can move health much more effectively to prevention, because we can see early patterns much, much earlier. It means that we can join up services so that people can get a much more interactive set of services from government, because we're joining up much more as government. And it also means that we can put data in the hands of people themselves, because I believe that people should control and have access to their own data. And if you see the data that's held on you, it can be incredibly empowering. It is in travel services, commerce services,
everywhere,
banking services. That data is being presented to you, and it's helping you have a more satisfying experience, a more informed experience, and be much more empowered in the relationships that you have with the services that you use. Why can't government be doing the same? And that's what we aspire to do.
How can we find that right balance where sort of the government regulates AI, but we make sure that safety is still paramount, but also we encourage innovation?
It's a fantastic question, which is so pertinent to the moment we're in, because we're in the foothills of this. And there's a sense of inevitability about where AI is going to take us, and that's also a sense of fatalism. Well, you don't have to be fatalistic about this, because this technology, there's two aspects to it. Firstly, there is the frontier, the conceptual, real driving force of AI. There's only 5 or 6 companies in the world that do this. I'm legislating this year so that those models that are being developed will have to be released to the Safety Institute so that experts can assess the safety impacts of the real frontier work that's being done before it gets released into the public. That's to have absolute safety on the big scale baked in. The other bit is every one of our regulators is now tasked with seeing how AI will impact their own specific sectors. That work is also ongoing. So it's been distributed across the regulatory landscape, and that work is ongoing, and my department is working to make sure that those regulators have the skills they need to do so. But we have to reassure people that these things are being done at the very, very beginning. It doesn't have to be inevitable how AI impacts society. We have agency in this. Government can regulate, we can work, we have great relationships with these companies, and for the good of the country and citizens, we need to shape it so it is a productive, supportive and enabling technology, not one that is always disruptive, that happens to us, not with us, and that's what we aspire to do.
Really good answer. And one important thing though is, as healthcare moves online, how can we make sure that those without digital access aren't left behind? So those in rural areas, perhaps those with a poor internet connection, and even most importantly, the elderly.
Yeah, there's 2 aspects to this. Firstly, there's the physical access to the technology. Digital exclusion is based on geography and socioeconomic background as well, primarily. There are also people, obviously, who are in urban areas who can't get access to some of this, and this is something that's quite shocking for me, just discovering this. You know, you can walk down the street and you go from 5G to no G and, and back and forth, and even in London it happens, which is pretty shocking. We're working on that, and we're just developing a strategy to get to those sort of not spots when it comes to connectivity. We are pushing assiduously to try and get to those parts of the country that have been left behind, and just a couple of weeks ago I put another 800 million into trying to get to some of those hard to reach areas. I'm very open-minded about how we go forward with this. Space is another opportunity for us to try and expand the reach of connectivity, and I'm looking into how we can try and capture some of that technology as well at the moment. But the second thing is about how technology is proactive. It's something counterintuitive about this. AI is going to drive huge productivity efficiencies and productivity gains throughout any area which has a lot of administrative functions. So let's take call centres. The NHS is riven from top to bottom with contact centres. Patients are mostly contacting the NHS. Now, the thing that most people would assume is as soon as chatbots and other automated functions start interacting with these services, that you would just reduce the number of call handlers. And those people who don't have handsets, who aren't used to dealing with services via apps, aren't comfortable talking to chatbots or whatever, they'll get excluded. But I think if we get this right, it could be completely the opposite. Because if you reduce the burden for calls coming into these services, because people aspire and they want to use apps and other sort of chatbots and so forth, that human capacity could be switched to being proactive itself. So I want to get to a service where if people who don't have access to smartphones, or for whether it's age or disability or other factors, that we will use data in a smart way to notice that they might need a call proactively. So why not have a service when you have that extra capacity, because it's being reduced by technology? The human side then becomes connecting to those people who aren't proactively connecting to the service. Another way of taking the NHS, which is overwhelmingly a reactive service, and trying to make it much more human and proactive. Calling somebody up and saying, we notice that you've not contacted your doctor in a while. We might know because of age and circumstance. We can ask them, have you fallen lately? You know, are there any issues that you're having? We think that it would be good to have just to come in and see your doctor because you haven't done it for a year or so, or 9 months. You know, how amazing would it be to have that service? And it's very counterintuitive because people think technology removes the human side.
You're right.
I think if we use technology correctly, it could actually make it more human.
Yeah, and the good thing is I think some of that already happens right now. So I know a lot of GP practices call up the patients that you haven't had your yearly check or send out a little text message reminder.
Yeah.
So it's a good thing. Thank you so much.
No,
It was a pleasure chatting to you.
Yeah, you too. Right.
Maybe in the future we'll go in depth into some of these.
I hope so.
And yeah, absolutely.
I really hope so. Anytime.
Yeah, thank you.